Repeated extension in lying. For this exercise, you want to be in the prone position or a push-up position. You want to have your arms straight underneath your shoulders. Hips are going to be remaining on the table. This exercise is normally prescribed in sets of 10, but I'm only going to perform 3. What I want you to do is press yourself up as far as you can go, keeping your hips on the table. At the top, you need to hold for 1 to 2 seconds and slowly let yourself right back down. There are 2 reasons why you would stop this exercise. One is if the pain starts with the exercise and it still remains painful after 15 minutes of terminating the exercise, please contact your provider. The second reason why you should stop this exercise is if your pain moves away from the spine and starts to go down one of your legs or both of your legs. Again, stop the exercise and contact your provider. We're going to perform the hamstring stretch against the wall. Big things. One leg is going to be straight up in the air, your knee is going to be straight, your toes are going to be pointed slightly inward. This bottom leg is going to be completely straight, where your calf is touching the ground, and again, your toes are going to be pointed slightly inward. We would want you to hold this position anywhere between 10 to 15 seconds, keeping your back on the ground, both your knees straight, both your toes pointing inward. If this is too intense for you and you're unable to keep your legs straight and you have any sort of a bend, to make it less intense, move away from the wall and repeat. As it gets easier, you can move yourself towards the wall. This is going to be the front plank series. It's a series of 4 exercises that progressively gets harder. Do not progress to the next exercise unless you can do 30 seconds with perfect form. The first one you're going to be on your forearms right underneath your shoulders, toes tucked underneath, lifting yourself straight up. Big thing, contract your core, have a good straight back. To progress the exercise, you're going to lift one leg up in the air. To progress again, both legs are going to be on the ground. Lift one arm up. The last progression is opposite arm, opposite leg. Side plank series. It's a series of 2 exercises. Do not progress to the next exercise unless you can perform the first one for 30 seconds with perfect form. You're going to be on your forearm, directly underneath your elbow. Hips are going to be stacked, feet are going to be stacked. First exercise, lift yourself straight up in the air, keep your hips stacked. Second one, you're going to lift your leg straight up, toes are going to be slightly down, make sure your leg is above the other one. Inside plank series. For this one, your bottom leg is going to be tucked up underneath. Your top leg is going to be straight. It is very essential that this top knee is perfectly straight, as it could put a lot of strain on that knee. What you're going to do is lift yourself straight on up. If this is too difficult, you can drop your knee down to the front to make it a little bit less. Back plank series. For this exercise, what you're going to do is lie flat on your back. Knees are going to be bent, hips are going to be bent, arms are going to be crossed across your chest. This is a 3 series exercise. You want to be able to perform the first one for at least 30 seconds with perfect form before you go on to the next. First exercise, back plank. You're going to lift your glute all the way up in the air, hold for 30 seconds. The next exercise, to get harder, lift one leg straight up in the air. Once you can perform that, you're going to start walking your legs further and further out in order to make the exercise harder. With that too, you could also lift one leg up in the air.